What is the problem with AC, vent and ice?
So again, it's evaporation of tears.
I was recommended surgical options and I purposefully avoided because I saw a very bad case of ocular keratitis, which is inflammation of the eye because of the frequent contact lens use. Many students were wearing specs right in front of me, and you can even easily count people who don't wear the specs.
Branding contact lenses as bad is not exactly correct either. There are indications where
And it's a very common thing to people applying kajal, the mascara, on the eyelid. Your take on that?
So I think mascara on the eyelid, especially if you have dry eye, should be definitely avoided.
How do we actually apply eye drops?
So you have to screw it into place, tighten it a little bit, make sure it's tight, and then reverse the direction of opening it. And then you can instill the eye drop like that.
Many people have applied onion juice on their eyes. Your take on that?
In fact, I saw someone talking about a urine eye wash. I remember a child who came in with a firecracker injury, but practically he never gained proper eyesight.
Before we dive in, can I be honest with you? It blows my mind that 57.9% of you who listen regularly still have not subscribed to our channel. If you enjoy the podcast, the stories, the signs, maybe even laugh at our jokes, could you do us a small favor? Hit that subscribe button. It takes only 2 seconds and helps us keep bringing you better guests and episodes every week. I'm truly blessed to have all your support, and I'm sure you will support me in the journey. Now, let's get into today's episode. Hello guys, this is Dr. Pal. Welcome to another episode of Gut Feeling with Dr. Pal. In this episode, we are interviewing my friend Dr. Rushad Shroff, a very popular ophthalmologist in Delhi. So we had a friendly conversation and we dwelled into multiple topics, into common day practices, whether you can apply cucumber on your eyes, blue light filters, screen time, and common modern day lifestyle practices, how it is affecting your eye health, how often you should check your eye health for your kids and also for your adults. And more importantly, we dwell deep into refractive errors, myopic glasses, what are all the surgical options available. If you're looking for answers, this is a podcast for you. Let's dive deep into it. Hi, Shroff. Thank you so much for being my podcast.
Thank you for having me here.
Oh, that's so nice of you. You're proving that you're an ophthalmologist, no glasses.
Yeah, I think I've been lucky with regard to that, and good genetics, I think.
Good genetics. Genes has to play a role, huh?
Yes, genetics also has a role with regard to refractive errors, whether it's myopia or hypermetropia. So there is a higher tendency, if someone in the family has a refractive error, there is a higher tendency for that to happen. But genes are not the only thing. There are other factors. Of course, we all experienced this during things like COVID, when the screen time went up during the pandemic. And of course, with excessive near work or screen time, we all tend to develop more of these refractive errors nowadays. In fact, there are studies that talk about how by 2050, almost half the population of the world will have glasses of some kind. And a very simple study which was done in some of the Eastern countries actually showed with a couple of hours of outdoor activity, indirect sunlight exposure actually, they were able to reduce the progression of myopia in children. So these things are quite important as well, apart from the genetics.
Genetics, yeah. Just to educate our audience, and if a person listening to this wants to know what is myopia, what is nearsightedness, what is long-sightedness, if you can explain in simple sentences.
So I think that's a very important question to address, and I think I'll use that eye model over there
please.
to
Please.
Kind of...
That's where we have the prop, okay. Please.
Kind of explain that. So the first thing to understand is, so when we think about myopia or any of these conditions, what's more important is to actually understand how light focuses inside the eye in a normal person who doesn't require glasses. So when we look at the eye front to back, what we see is the front layer, the cornea. That's the transparent structure through which light goes into the eye. You have this circular opening called the pupil. This, again, transparent structure in younger people called the lens. And then light goes and focuses on this orange structure called the retina, which is effectively the film of the eye. That's where the image is formed, and then through this structure called the optic nerve, that light is transmitted to the brain, and that's how we actually perceive light and how we see. Now, when you have myopia, as the name suggests, it's also called short-sightedness or nearsightedness. What that means is you can see objects near or close to you, but you can't see objects that are far away. And therefore, you need a minus number to correct this actually. Now, in myopia, what happens is either this structure, the cornea, which is the front of the eye, either it's overly curved or the eyeball is a little bit longer. So you have a larger eyeball. And because of that, light tends to focus, instead of focusing on the retina, it focuses somewhere in front. And by the time it reaches the retina, the light has scattered. So to correct that, we use minus glasses. What the glass does is effectively it shifts the image from here onto the retina, and that helps us to see clearly and a sharp image is formed.
So the target is missed.
Yes, the target is missed.
The target, the light is falling in front of the target.
Yes, yes. And conversely, if you have a hypermetropia where you have a plus number, or you're farsighted, that means you can see things far away from you, but you can't see something close to you. In that, then either the eyeball is too short and the light is focusing behind, or the cornea, which is the front structure, is too flat, so it focuses the light behind. And in those people, we use plus glasses. They actually bring the focal point back onto the retina because they compensate for those changes in the cornea and the length of the eyeball.
So the target is beyond.
Yes.
Right, beyond
yes.
the required one. Okay. The light falls beyond the target.
Yes.
So I'm going to take me as an example. So I had myopia minus number for a long time, and now I'm starting to not to see things very closer. My wife doesn't want to. I mean, I don't want to believe in, but my wife keeps on saying, "You are getting older."
I think I'm in the same boat as you.
So as age advances.
So that's a separate refractive error that is called presbyopia. That's basically our muscles as we become older, the muscle that controls accommodation, which is our ability to see close to us, that becomes weaker as we ballpark figure reach near about 40. So what happens is typically earlier on you could bring something right here and see. And as those muscles start to become weaker, you have to hold things a little further away. Or again, you need a plus numbered glass to actually bring those light rays into focus. That's a separate issue. It's generally happens to pretty much everyone. I wouldn't call it a disease. It's a process that happens because we all age.
I wore glasses around 3rd grade. But now I went and gave a health education class to a UKG, LKG kids. They are having so much amount of many students were wearing specs right in front of me, and you can easily count people who don't have the specs. Any reason?
I think that's a great observation. I think that's changed remarkably since the time when I was in school. For example, you'd have typically 3-4 kids wearing glasses. Now pretty much half the class, or maybe even more than that sometimes, they could be wearing glasses. And again, there are a lot of factors which are involved in this increase in myopia that we are seeing. One, of course, is again the use of screens, whether it's smartphones or whether it's mobiles, etc. Near work, excessive amounts of near work, that has gone up of late. And if you've noticed, a lot of our activities have shifted indoors.
Correct.
And because of that, there is an increase in myopia. Also, like I mentioned, there is less outdoor activity. We don't do enough outdoor activity. There's not enough indirect sunlight exposure. And because of that, these changes that I was alluding to in the eye tend to happen. So either the eyeball's length tends to grow more when you have more indoor activity and less indirect sunlight exposure. And because of that, again, the target gets missed in front, myopia that we were talking about.
So let me summarize what you said. So for a young kid, if they are focusing on more screens indoor, and of course not that much amount of time outdoor, not because of the time, there is no space as well to play. Both these activities coupled together, what is happening is the size of the eyeball is getting bigger and the light is getting targeted in front of the retina.
Yes.
And not on the retina. So you will need a minus glass to make the light fall on the retina so that your brain can process the image.
Exactly. Beautiful. That's perfectly summed up.
Beautiful. I took my son for an annual ophthalmological exam. Let me ask you, for kids, how often we should check them for vision?
So I think the first thing that's important in childhood is to notice whether anything is amiss. So if a child, for instance, is not reaching for objects or is not able to comprehend their surroundings around them, then even a younger child can go in for an eye examination. Otherwise, if the child is doing that, then an annual eye checkup is generally good enough.
From what age?
So typically, you can even start examining children from the age of 3 or 4. There are ways to examine them. We have charts which are specifically made for pediatric eyesight. So there would be images instead of alphabets that you need to see. And there's a age-old technique called retinoscopy, where we actually look at the light reflex in the eye to detect whether there are any changes in terms of refractive error. It's very important in children to detect this early because of something called lazy eye or amblyopia.
What is lazy eye?
So a lazy eye is where one eye, normally it's one eye. One eye is a little bit stronger. The other eye, for whatever reason, you may have a refractive error which is uncorrected. That means there may be myopia or hypermetropia, which the parents and the child are unaware of. Or there could be a little bit of squinting of the eye, which is a movement of the eye to one or the other side. And if that is not noticed, then during the time that the eye is developing, what tends to happen is that the brain tends to focus on the better eye, and the worse eye gets ignored. And therefore, during development, although anatomically the structures look fine, developmentally or functionally they do not develop adequately. So if this is not detected, the eyesight can get permanently affected in that weaker eye. And it's very important to detect this because treatment is also necessary to be started at a younger age. So say someone has a lazy eye and they come into the clinic at the age of 25, there's not very much that we can do for them. But say this is detected at the age of 5 or 6 years, then we start something called patching. Patching means we make the child for certain hours in the day close the stronger eye. So we put like a black patch or something over the eye.
To train the other eye.
To stimulate the other eye. And the earlier this is done, the better it is because you can break that lazy eye cycle.
Is this common?
It is, I wouldn't say very common, but it's not as rare as we think it is
Yeah,
either.
that's what I thought. So is it safe to say that annual screening of kids can start from 3 to 4 years of age, regardless of whether they have symptoms or not?
Yes, I believe that's correct, and it's a good thing to get an annual screening.
Annual screening. For adults, tell me how often we should get screened.
So adults, again, annual screening is very important. And the reason annual screening is important is very often there are complaints or particular diseases which do not present with overt symptoms. And all of us have a tendency, all of us tend to be busy, we tend to ignore minor complaints. So let me give you an example, a disease like glaucoma. Glaucoma means that the optic nerve which conducts the light impulse from the eye to the brain, that becomes weak. Probably because the pressure in the eye has gone up. Now, glaucoma most of the time is fairly silent. That means the patient does not really notice anything because it does not affect your central vision, which is what we use most of the time. Most of the time it affects our peripheral vision initially. So typically you may start missing objects on the side while driving, but that is not a complaint that all of us would necessarily notice. So because of that, the issue with glaucoma is that as the disease progresses, the damage is irreversible. So whatever damage happens to the nerve has happened. You can't make that normal again. So the key is to actually diagnose this early and to start treatment early. So because
patients with high blood pressure or increased risk as well, correct?
Yes, high blood pressure or diabetes also is a risk. In glaucoma, you can have fluctuations in blood pressure levels, which can also be a risk. A sudden dip in blood pressure or a sudden spike in blood pressure, that can cause a risk for glaucoma as well.
There's a myth around there that if the power of the myopic glasses can just grow only until 18 years of age, and then beyond that, you don't have to really check your eyes, and that's the same prescription. I have had people having the same prescription for the last 10 years. Have you seen that?
Yeah, I think, so the way to answer that is that, yes, most of the time our length of the eyeball stops growing somewhere between the age of 18 and 21. So commonly that, that would stop. However, there is a subset of myopia called pathological myopia, where you have higher minus numbers, where the eyeball keeps growing.
What is that number, more than minus 3,
I wouldn't say there's a specific number, but typically it's higher than about 8. Typically you would see pathological myopia in someone who has more than -8, -9. It would be in that range. But there, again, it just keeps growing. So apart from, like we said, the glasses is one aspect of it, but of course your retina and your optic nerve, all these things should be checked annually.
So while we are in the discussion of myopia, glasses, and everything, we talked about screen time is playing a major role not only in kids or also for adults. Do you have any ophthalmological rule of screen time? What should a patient should do?
So that actually depends a lot on age as well. So we can start with the pediatric
Yes,
age group.
please.
And very, very important, I think, for all parents to understand this is under the age of 2, please just avoid screens. Between the age of 2 and 5, again, limited to an hour ideally, and not more than that as far as possible.
Hours including everything, work time, school time, your iPad time, TV time, everything included.
Yes, for under 5 years of
Under 5
age.
years.
Of course, after 5 years of age, you can relax that a little bit. We understand it's not practical to say not to use screens at all. So you would typically say limit it to as much as required for doing your assignments or work or whatever homework from school is given to the child. But avoid leisure on the screen as far as possible. And in adults, of course, the common complaint with which patients come to us is a grittiness or an irritation or a fatigue. A lot of patients come to the clinic saying ki my eyes are very, very tired, and that happens very commonly because of screens. Screens tend to cause our blink rate to go down, so we don't tend to blink properly, and because we don't blink properly, our tear film that covers the eye, that tends to evaporate faster.
Many of my patients, they come with gut health, but most of the time they have brain gut axis problem, and one of the main problem is ocular problems. The most common complaint they have is watery discharge. Watery eyes. I wake up in the morning, just water is pouring out of my eyes, or at the night when I'm going to sleep, I'm having watery eyes. And most of the time they end up in dry eye. Prolonged usage of screen, decreased blink time, as you said, the tears are not being secreted that much, so dry eye is created, so you are having a lot of water. Is that make sense?
Yeah, so it wouldn't be tears not being secreted as much, it's more tears evaporating faster than usual.
Okay,
So that causes dry eye and digital eye strain basically.
So, I have a 6-year-old and an 8-year-old. Okay, I am concerned about their eye health. What should I do to protect their eye health in terms of screen time or any accommodation problem?
So ideally, like I said, limit the screen time as much as possible.
That one arm distance helps?
Yes, it does. There are various things that actually help. The brightness of the screen should not be very high. So the screen brightness should be set at a level where it doesn't act like a source of light on its own.
I see.
It shouldn't be too low, but it shouldn't be too high. The font size should be a little bit larger and more comfortable to use. A larger screen is always a little bit better than a smaller screen. So for instance, doing assignments on the mobile is maybe not the best idea. The lighting should be adequate in the room. So it should come from behind you rather than again hit the eye from in front. And of course, frequent breaks are very, very necessary. In children, like I said, some amount of outdoor activity in indirect sunlight exposure is very, very important. And of course, they shouldn't be looking at their mobile when they're outside. It should just be playing outdoors. So that also helps. And to limit the screen time. Also, the environment within the house or within an office space in an adult, we very often have AC vents directed towards our eyes.
What is the problem with AC vent and eyes?
So again, it's evaporation of tears, because any kind of air directly directed at the eye would cause an increased evaporation of tears. So as such, the screen is causing that anyway, and then you're making the problem worse by adding, a heater blowing towards the eye or an air conditioner blowing towards the eye.
So the cold air increases the evaporation of the tears, making it more dry.
Yes.
And then increasing the watery secretion eventually. So my patient asked me, you're saying dry eye, but I have so much amount of water in my eyes. How can that happen?
So the way that happens is actually something called reflex tearing or reflex watering. Like we were discussing, what happens is there's a layer of tears that covers the eye. Now, when you're using screens or when you have air conditioner air going towards the eye, that layer of tears tends to evaporate faster. And as soon as it evaporates, that signal goes to the brain that there are no tears covering the eye. So because of that, there's a reflex increased secretion of tears, and that tends to come out as a watery discharge.
We talked about the screen time and how it is damaging to the eyes. It's mainly because of the blue light that is being emitted from all the devices. Your take on blue light filter, is it really worth?
So I think blue light filter is a bit of a topic where we don't have conclusive evidence one way or the other. There's no harm in turning on the blue light filter in your devices that's helpful. So I would recommend that to people, but whether specifically you need to buy blue light filter glasses, there's a lot of parents who come in and ask, should I get my kid blue light filter glasses? Will it prevent myopia progression? That's practically not required. I think the jury is still out on this. I would say we need to wait for more evidence to give a conclusive answer to this question.
So, I have been a myopic for a long time, and I was recommended surgical options, and I purposefully avoided because I saw a very bad case of ocular keratitis, which is inflammation of the eye because of the frequent contact lens use. So that's why I said I am not. It is better that I wear the glasses. As an ophthalmologist, your recommendation for contact lens?
So I think branding contact lenses as bad is not exactly correct either. There are indications where contact lenses actually are the most important treatment. In a disease called keratoconus, actually contact lenses are pretty much the only thing that makes the vision clear. Having said that, you have to be very careful when you use contact lenses. If you're using them, it is very important to make sure that you don't sleep with the contact lens on, for instance. And those, like you mentioned, keratitis can be quite devastating to the cornea. It's difficult to treat. It can leave permanent damage on the cornea. So that one has to be careful of. The second thing is, of course, we've seen people go swimming with contact lenses on, and they can end up with infections, things like acanthamoeba, which is a parasite which can cause an infection, which again can be quite devastating to the eye. So these things have to be taken care of. If you are using contact lenses, you have to be very careful about these things. But having said that, they are a reasonable option to correct myopia as well, and branding them as totally terrible is not exactly.
No, I think the problem is I have a biased opinion because we see only the patients, very bad case, right?
Yes.
We don't see the majority of the good patients. So that's why I didn't go for contact lens at all. And I was scared about LASIK to start with, right? And then people told me that you look a little bit educated if you have the glasses on. Then I said, okay, good. We'll keep the same way. Now I want to know what is a surgical option. Like, LASIK is something was available for a long time. So please educate the audience. What is LASIK?
So LASIK is basically a laser procedure which is used to correct myopia, hypermetropia, or astigmatism. So these are the conditions that LASIK can correct. Overall, it is again a good procedure to correct this. There are various surgical options nowadays. So LASIK would be one broad category of surgeries that we do. The other is something called lenticule extraction procedures, where you have something like SILK, SMILE, CLEAR. These are the various different options available in that. And all of these procedures also, if they are done for the correct indications and making sure that you've taken everything into account, they do well for correction of myopia or myopic astigmatism especially. So they are good options as long as you respect the criteria for the procedure.
When they use laser, we talked about the light falling in before the target. They will adjust that.
Yes, so I think the easiest way for me to explain the differences between LASIK and SILK or lenticule extraction is to kind of explain it. I always do this. I use a book in my OPD to explain the difference and kind of make it more easy for people to understand.
Of course. So imagine me as your patient. I want you to explain what is the difference between LASIK, SILK. The patient's age is 25-year-old.
So in LASIK, what happens is a flap is created in the front layer of the cornea. So either a motorized blade called a microkeratome is used, or we used a femtosecond laser, which creates this precise flap like this. In the second step,
using a laser, you are creating that flap on the superficial layer.
Front layer of the cornea. The second laser actually treats on the cornea and changes the shape of the cornea.
And cornea is the first
the front layer
of the eye.
In front of the black part.
Front of the black part of the eye.
And then at the end of that, we put this flap back into place. And it heals on its own. It heals fairly rapidly, and that's what happens in a LASIK procedure.
That's the long-standing procedure.
Yes, that has been there for a while now. The other option is something called lenticule extraction, something like a SILK procedure, in which we do not create a flap in the cornea. The laser creates a circular disc inside the cornea, and there's a small incision, a 3 to 5 millimeter incision created on the side. And we go in and remove this tissue from inside the cornea like this. So it comes out through a much smaller incision, and that is how the shape of the cornea is changed, and that is how light is then focused as a sharp image on the cornea. So this becomes a flapless technology.
Wow. So precision should be like really accurate.
Yes, the laser has to be very, very precise. The SILK procedure is done with the Elita femtosecond laser. It's one of the newest generation of lasers. One of the main advantages of this laser is that it uses very low energy to actually create this lenticle within the cornea. So the resultant advantage is that you wouldn't have so much inflammation in the eye, and therefore the recovery is reasonably quick. People also ask, there are other flapless procedures. There is something called a PRK, which is a flapless procedure as well. That has also been there for a long time. The difference in PRK versus, say, a SILK procedure or LASIK procedure is that the top layer, not a flap, but the top skin of the cornea, that is removed with the help of either a medication or with a laser. And then the same laser which I alluded to in LASIK, which reshapes the cornea, that changes the shape of the cornea, and then the skin grows back in 3 or 4 days' time. The disadvantage of PRK as a procedure is predominantly that it takes a little bit of time for that skin to heal. So it takes 3-4 days for that to happen. And the visual recovery tends to be a bit slower in PRK. But all these procedures have their role in treatment of myopia and myopic astigmatism.
So as a person listening to this podcast, okay, let's say they're wearing a glasses and they are, let's say, 30 years old, and they are coming to you and then they're asking whether I will be eligible for these kind of surgeries.
So eligibility for these procedures, you have to make sure of certain things. We do some scans in the OPD
To analyze the anatomy.
Yes, and the anatomy of the cornea is very, very important. So because we are using these lasers to reshape the cornea and effectively make the cornea thinner, we have to make sure that the shape of the cornea and the thickness is adequate for a patient to undergo these procedures.
Okay.
Very important factor is that the number should be stable. So if someone is beyond the age of 18 to 21, where the length of the eyeball has stopped growing and the number is stable, then they are a good candidate to undergo a refractive surgery.
Okay, so 30-year-old coming to you, scan is done, okay, cornea shape is good, and my power is around 4, it has been stable for 6 months to 1 year, so check, I'm eligible. Anything else?
So the other things would be to rule out that you don't have severe dry eye.
Dry eye, you do.
That is very important. Any kind of other conditions in the body like diabetes or collagen vascular diseases or autoimmune conditions, those should not be there if we are going ahead with a procedure for you.
Okay.
And we would also examine the eye in full detail. So we have to make sure
there is no local problems.
Yes, in the retina or other structures have to be taken care of before.
Correct. So after complete evaluation, we said that, okay, I am good for surgery. Okay. Given this, what is the advantage of SILK over LASIK?
So the main advantage of SILK over LASIK is it's a flapless procedure.
Correct.
So because there is no flap, in case of an injury to the eye, the chance of a flap displacement is there in LASIK, which cannot happen in a SILK or a lenticule extraction procedure. So that is a major advantage in, say, someone who's in combat or in contact sports, or a sports person in general, where there is a higher chance of getting hit in the eye. Now, in those people, there's definitively a very large advantage of having a flapless procedure. The other advantage of the incision being smaller on the surface of the cornea is that the surface does not get disturbed as much. So dry eye tends to be a lot less in lenticule extraction procedures. And of course, with screen time increasing and a tendency for dry eye, that is another major advantage. And we've done studies which have conclusively shown that the dry eye is less in lenticule extraction procedures compared to LASIK. Also, there is some amount of work going on preservation of corneal nerves. And that seems to be something that is encouraging from this technology as well.
More favorable to SILK.
Yes.
How about the recovery rate? Days?
So the recovery rates are pretty similar. You can have, normally within a week, you would be fairly clear in terms of your visual acuity in both procedures. You would have some patients who are very good on day one in either procedure. Some patients, it takes a little bit of time to recover. But typically in a week, you would be back to your routine activities. Of course, there are precautions that we recommend for up to a month as well in either procedure. But functional visual acuity is very good within a week itself.
Is there any power limit, like more than 7 you shouldn't do?
So there are cutoffs for power limits for all of these procedures. The machines allow you to do pretty high corrections for both cylindrical powers where the light focuses, not at an exact point, but in the form of a line, which causes a slight blur. That's astigmatism, as well as the spherical myopic power. But these powers are actually calculated based on the patient's corneal thickness, the corneal shape. So based on that, we actually set our cutoffs for refractive correction with either SILK or LASIK. So there's no one number that I would say.
So even if I have high power -7, because the reason I'm asking is many people are thinking that if I have high power -6, -7, I may not be eligible for this procedure.
So very high powers, say, typically more than 9 or 10, we prefer to do something called an ICL, where we implant a lens inside the eye to correct the power. It's called an implantable contact lens, where, you are going to change the shape of the cornea too much by doing a laser on the corneal surface. So very high refractive errors, we would actually look at ICL procedure rather than any of the corneal-based procedures.
So you'd say like less than 8, 7.
Yes, ideally that range would be.
And I'll ask you another common question. People are post-operative complications. If I get something, if LASIK or SILK, what if my eyesight is gone or any inflammation, infection? What is the rate of post-operative complication in these procedures?
So overall, the rate in refractive surgery or laser surgeries is very, very low. It's an extremely low rate of complication. There are common side effects with any of these surgeries. And the most common thing is some amount of dry eye. And that's why we screen for dry eye before we actually do the surgery.
Yes.
Even with a lenticule extraction procedure like SILK, you would have some amount of dry eye post the surgery. So typically it takes a few months for that to settle down.
But besides that, pretty safe procedure.
It's very safe. You may have things like glare. So initially when you're driving at night, and that's why we ask patients to maybe wait a couple of weeks before they drive too much at night, because you may feel some amount of scattering of light at night when you're driving, and that also generally settles down. Very rarely these would become chronic problems. The other issue, of course, which you alluded to, is infection. Now, infection risks in laser procedures are very, very low. There are extremely low rates of infection. Having said that, you can never say 0% risk in any surgery.
It's very minimal. The more important thing is the vision loss. There's nothing to do with the vision loss in this procedure.
So again, I mean, if you were to get a bad infection, then that is the way the eyesight would get.
Not the procedure per se.
The procedure itself cannot really cause vision loss.
Okay, so coming back to the same patient that we discussed, 25-year-old, wants to take the glasses out, comes to you for checkbox, anatomy of the eye is done, check. Eye power is 6, check. No dry eye, super. No other medical problem, super. And then you give the option of LASIK and SILK. I prefer SILK because the post-operative dry eye is slightly lower. I do it. The recovery rate is also good. There is no post-operative complications. I'm very happy with your service. What is the chance of recurrence? Will the same problem happen again?
The number coming back you're referring to.
Correct.
So the number coming back, generally the rate of that is very low again. If it's a 25-year-old, we normally expect that till the age of around 40, there will be not much fluctuation in the number. After the age of 40, generally presbyopia sets in, and that's the most common reason why a number would develop, where you would develop some amount of reading glass number. And that has to be corrected with glasses at that stage, because most of the treatments for presbyopia in terms of lasers don't really work that well. There are a small subset of patients where you can have something called regression, or the minus number slightly coming back. In your scenario, it's a -6. So normally we wouldn't expect that much number to come back, but you can have minus numbers which minorly come back post-surgery. And that can be done with a laser touch-up. You do a laser to just kind of retreat that power.
Got it.
And that can be corrected that way. Or, of course, if the patient doesn't want to do that, then glasses can also be used for that.
But for majority, they don't have to wear the glasses again. most of the times.
Yeah, till at least the age of
40,
40.
45, until the presbyopia.
Yes.
Super. The surgery is done, the recurrence rate is low. How often should I follow up with you?
So follow-ups are still very, very necessary. The reason is that we've corrected the shape of the cornea and we focused the light onto the retina, but we haven't changed the rest of the structures in the eye. So if you're myopic, you have a higher tendency for retina problems throughout your life. So you still need to get an annual checkup done regardless of, whether the number is fully corrected, because you need to keep a watch on the rest of the structures inside the eye. So an annual checkup is a non-negotiable. You're supposed to get that done anyway.
One more question on this procedure thing. You have so many procedures. When a patient comes to you, when they ask you a question, which procedure should I opt for? What will you say?
So I think what we need to understand is that all these refractive surgeries work very well for correction of these refractive errors. So there's no one surgery that fits all. There's no one size fits all for every patient. I think it's important for us to analyze the data that's in front of us before taking a call on which surgery is better. For example, if someone is in a combat profession or if someone is in contact sports, of course, a lenticule extraction procedure would be good for them. Or say if they have a little more time to recover, even a PRK is a good option for them. But does that mean LASIK is a bad procedure? I don't think it would be responsible of me to say that that is a terrible procedure if you're getting it done, or this is way better than that in that sense. Like I mentioned, it is a combination of the surgeon understanding their technology, understanding the patient in front of them and their requirement, and then deciding which procedure. And believe me, most of your surgeons and most of your technologies will give you excellent results.
So one practical question in terms of children. So let's say I have a 8-year-old with -3 glasses. Can I come to you for LASIK or SILK?
No, I generally it is not a good idea to get any kind of refractive surgery done in a child for the simple reason that the eyeball is growing. So till the age of 18, as long as the child is still in the growing age group, it is definitely contraindicated to do a refractive
So you
surgery.
wait until 18 and then you make a call.
Yes.
Okay, super. Sounds good. People are using AI to do these surgeries and you are just standing behind and watching your TV.
I wish it was that easy. So AI has been there in ophthalmology in a large number of fields, especially in diagnosing diabetic problems. Even these lasers and these machines have a lot of AI inbuilt for the algorithms to actually analyze the eye. But the actual treatment is still being done by your doctor. It's a combination of the surgeon and the technology which actually does the treatment. It's not like AI will do everything for you. And anyone claiming that is not being completely correct about it.
Many patients who plan to have refractive surgery, they are saying they are very excited about this because they are saying me that they're going to have a supervision more than 20/20. Is it possible?
So I think the first thing we have to understand is what does 20 by 20 or 6 by 6 actually mean? What that means is that what a normal person sees at 20 feet away from the chart, you are able to see the same chart standing at 20 feet away from it. So that is normal eyesight, which is 6 by 6 or 20/20. Now, there are claims that we will get supervision or eagle vision. Now, I think all of us need to understand that an eagle is not a human being. The retina of an eagle has higher number of cone cells. The cone cells are the cells in the retina which are responsible for fine vision. And the fovea, which is the area where light focuses in the retina, that's larger in an eagle. Now, why does an eagle need that vision? Because he's hunting from a height, he's looking at something very small, and he needs to get 20 by 4 or 20 by 5 kind of vision.
We only have chicken biryani.
So
we don't need that much.
So practically, yes, with any refractive surgery, you can get better than 20/20 vision at times. And there are patients who've not had refractive surgery also, who don't wear glasses, who can see a line or two better than the last line of the chart. But practically saying that, that is what we will promise with a laser is not practically possible because you're treating the cornea. You're not changing someone's retina or the basic anatomy of the eye. So I mean, it's possible to get better vision, but I think that's a myth that we need to bust.
They may get 20.1. A short segment on modern lifestyle and eye diseases. Okay, number 1. Applying cucumber on both eyes cools the eyes. What do you think about it?
Well, if you put it in the fridge, it'll cool the eye a little bit. But I don't think that's going to help you specifically improve your eye health.
In the spa, they have cucumber, right? You see the
They
picture?
do. Anything cold, a cold compression is a good thing for an allergic eye disease. So if someone has allergies in the eye, we do ask them to do a cold compress. But putting food on the eye is always a little bit dangerous. So I would stay away from the cucumber and just use either an eye mask or a clean hanky or towel wrapped around an ice cube, and then do a cold compression of the eye.
So stay away from the spa who's showing the cucumber. So in general, cold, but only for allergic, or in general, exhausted eyes or eye pain, cold compresses helps?
So warm compression actually helps for dry eye, because there is a condition called meibomian gland dysfunction, which is part of the similar computer vision associated dry eye, where our tears evaporate faster. So applying a warm compress for about 5 to 10 minutes before we sleep, actually that heat allows those glands to open. There is a layer of oil that covers the water layer in our tears. And that layer of oil forms better when you do a warm compression, because that opens these glands that secrete that layer of oil over the tears.
Another common practice is people gaze at the sun. Have you heard of it?
Unfortunately, I've heard of it, and I've seen a few patients who have done that. Sun gazing will not improve your eyesight. The only thing that it will end up doing is you may end up getting a retinal burn. And if you get a retinal burn, those cells are permanently damaged. So it can actually be quite detrimental or harmful to your eyesight. So sun gazing is definitely a no-no.
Sunglasses, do you recommend anything besides looking cool?
So UV protection in sunglasses is found to be helpful. It's very useful in patients who've undergone a cataract surgery where the lens is very clear, because UV light has been shown to increase the chance of getting what is called age-related degeneration of the retina. So that causes a change in the retinal structure, which can cause the vision to become worse. So enough protection from that kind of light by a sunglass always helps.
So it is better to wear a sunglass when you are going in a bright sunlight.
Bright sunlight, it does to some extent help reduce
The UV related damage.
reduce UV related damage, and also cataracts forming early. It can help with that, or things like pterygium, which is a growth on the conjunctiva, that can be reduced with that.
But people are not removing the glasses even when they're in the shopping mall.
I think that's for style.
That's a problem. All right. And it's a very common thing to people applying kajal, the mascara, on the eyelid. Your take on that?
So I think mascara on the eyelid, especially if you have dry eye, should be definitely avoided. Again, it kinds of blocks off the glands which secrete the oil layer, and it can make your dry eye worse. Occasional use is okay, but in general it should be avoided. It can also cause allergies in some people, and again cause a little bit of redness or irritation in the eye. So it's very, very important, even if you are using the mascara, to be very careful about removing it properly at the end of the day if you are using it. But as an eye specialist, I would say in general it's better to avoid
Does it
it.
matter? Is it herbal mascara, synthetic mascara? Does it matter the ingredient?
I don't think so. It's just the particulate matter which can cause issues to the eye. So I would, in general, avoid it. And very funnily, patients come for LASIK or refractive surgery or SILK with, sometimes wearing an eyeliner, and you have to tell them we have to remove all this. So it's better to remove this 1 or 2 days prior. Otherwise, half an hour, 40 minutes before the surgery are spent in cleaning the eye.
So we ask this question to any doctor who coming on the show, is that any shocking story that you may have really affected you from your ophthalmology practice?
So I think the shocking story which I can really recall is, we've had rotations around the festive season, and it's very tragic to see this at times. That I remember a child who came in with a firecracker injury, and both eyes were actually affected by the firecracker injury. And his cornea had ruptured. The rupture had gone back towards the white part of the eye, and the optic nerve was also damaged. So we spent about 2 hours suturing the eye to make sure that the anatomy was restored. But practically,
Diwali crackers.
Yes.
Those kind of crackers.
But practically, he never gained proper eyesight. But if firecrackers are being played with, then please play very, very responsibly. And, you should be as careful as possible. As ophthalmologists, we feel strongly that, these are avoidable cases that have affected these children, and there's nothing much we can do after a point for them.
Of course. Okay, so my topic is gut health. Okay, whichever the guest comes in, I'll always connect them with gut health somehow, whether they like it or not. So anything that I can eat to prevent myopia or prevent the progression of myopia?
I wish again there was something like that.
No?
You can't eat something to prevent myopia specifically. Of course, things like carrots and green leafy vegetables help with, conditions like vitamin A deficiency and stuff, but not with reversing myopia. So myopia you can't treat with that.
Myopia is just because of anatomical problem,
It is a structural
structural problem. So lack of screen time or outdoor time is the preventive measure,
Yes.
not through diet basis. Then why do they say they eat a lot of carrots, you will have a lot of eye health?
I think that was again from a time where vitamin A deficiency was a lot in India a few years back. And at that time, you would have corneal ulcers because of vitamin A deficiency or severe kind of dry eyes, keratomalacia. Those kind of problems, yes, and at that stage, it was very important to supplement nutrition that way. And in the interiors, deep interiors, where there's not as much access to healthcare or to information on this, you may still see patients with that. But overall, that's become less prevalent of late. So diet for the body is generally important. You know that better than I do. And the eye is an extension of the body, so it would help to keep the eyes healthy. But diet itself can't specifically treat issues like
Is the vitamin A deficiency leading to eye problem is common now?
It's much rarer
Much
now,
rarer now.
than it used to be.
Used to be.
It can still happen. We rarely do see cases of that, but it's not common anymore. So no amount of carrot is going to help prevent your myopia or prevent myopia progression.
No amount of cucumber as well?
No.
Okay. Or how about fish oil capsule?
So fish oil, again, it's a bit of a controversial topic because omega-3 fatty acids may have some role in dry eye, but we can't say again 100% that by eating this you will prevent dry eye.
If you don't have dry eye, just taking fish oil capsule may not improve or increase your eye health.
No, it may not change it very
Change it
much.
very
In general, it would help for the body, and that is how it would help the eye as such.
Have you seen people using green tea bags on the eyes?
I have. I've also seen people put coffee into a cut over the eye, but I would again not really advise that. There are much better ways to treat this rather than use food. That lady who came with coffee on a wound over the eyelid actually got an infected wound, and then a lot of antibiotics had to be started, and only after we had kind of controlled the infection could we suture that wound. So
Oh my God. Oh my God. Your take on milk?
So milk, as far as, again, vitamin D deficiency has been linked to a few things in the eye as well, including dry eye and ocular pain. Again, there's a lot of work on this, but conclusive evidence one way or the other is not like 100% one way or the other. So I would say it's a good supplement to generally have, but again, specifically saying that milk alone will make your eye health better is...
As a balanced diet, you can add milk if you're not lactose intolerant.
Yes.
Super,
Yes.
super. Toothpaste.
Nowhere near the eye. Good for oral hygiene, I guess.
But things have happened. That's why I'm asking.
I know. I've seen chemical injuries with perfumes, with toothpaste. with all-
Perfumes, huh?
Yeah.
People apply perfumes to the eyes.
Trying to apply here or there, and then it goes into the eye. So chemical injuries can damage the cornea. And
I'm
the
curious,
conjunctiva.
what happens when perfume goes to the eye?
So the top layer, the skin of the cornea can get abraded. Basically, there is alcohol base in that. So the skin sloughs off, and that can be very, very painful because any kind of scratch or defect on the cornea can be a very painful condition because the cornea is a very highly sensitive structure.
Oh my God. So, as a gastroenterologist, I recommend ghee for gut health because it's a wonderful source of fatty acids. Except that it's rich in calories, so moderation is amazing. So believe me, since I started using social media, I started having dry eye because of more frequent exposure, and I use these eye drops sometimes. But now it is much better because I limit my screen time. How do we actually apply eye drops?
So, funnily enough, we did a small clip about eye drops and it went viral on social media. And what we realized was a lot of people don't know actually how to open the eye drop in the first place. So I think I'll just demonstrate that so that there are no issues in opening the eye drop, and then a few things about how to use the eye drop. So I think we have this eye drop bottle over here, And generally you have a cap like this and you have this layer below that. So the way to open it is to actually remove this particular thing. It has a opening sharper thing on the inner side of the bottle cap. So you have to screw it into place, tighten it a little bit, make sure it's tight, and then reverse the direction of opening it. And then you can instill the eye drop like that. So the important thing while opening the bottle is to ensure that you don't use random sharp objects like a toothpick or something like a safety pin to just open the eye drop bottle, because that can be contaminated and that can contaminate the solution and cause an infection as well. It's very important to remember while instilling the eye drop to pull the lower lid down and instill an eye drop from on top, and make sure that the top of the bottle nozzle does not actually touch the eyelid, because that can cause an infection, or if you touch the cornea with it, it can cause a scratch in the cornea. If you're using multiple eye drops, it's important to make sure that there is a gap between these eye drops, so at least 1 or 2 minutes of a gap between using the eye drops. Each eye drop bottle comes with a set of instructions, so it's important to see the instructions about the drops usage. And when you're wiping, make sure that you dab and don't actually wipe the eye drop off over the eyes vigorously. So those are some of the tips regarding eye drops that we should keep in mind.
How long you can use the eye drops once opened?
So in general, eye drops once opened should be used within a month. So it's important to check the expiry date, but once you've opened it, within a month you should consume the eye drops bottle.
Okay, so this is a segment called Gut Instinct. So we usually ask you some questions and then you should just answer right off the bat. Okay. If you could teleport, would you go to a football match, golf course, or an ophthalmology conference?
If I was presenting groundbreaking research for which I'd get a Nobel, then the conference, otherwise to the golf course.
Golf course. Okay. Early morning surgery or late night emergency call?
Early morning surgery, definitely.
Long research paper or a quick surgery?
I think both. I like both of them.
Do kids really need blue light glass for online classes? Yes or no?
No.
What if eyes could talk? What would they complain to each other?
Give me a break.
That's a nice one. Is there any favorite quote you follow at your work?
So I love this quote from the movie Patch Adams, that if you treat a disease, you may win, you may lose. But if you treat the patient, I guarantee you will always win. And I think medicine at some level is an art, and I think we shouldn't forget that. And the patient is at the center of that art. So understanding the patient and actually treating the human being behind the disease is way more important than just focusing on the disease.
So deep. So deep. I wish everybody understands that, because it has to be personalized. It has to be personalized. It cannot be one size fits all, and that's how you have been treating your patient as well. Such a wonderful opportunity to meet you. Thank you so much for your time. And is there any one thing that you should tell our audience, a person listening to him or her listening to this podcast? Anything that you can say for eye health?
So first of all, thank you for having me here. The one thing I'd like to say is, please don't blindly follow social media hacks for eye health, because you get a lot of random things. In fact, I saw someone talking about a urine eye wash, and urine is excreted from the body because it's waste material. So my one advice would be, don't blindly follow things. Do your research, understand what it is, and go to an ophthalmologist if you have an issue.